My pleasure.
This whole fall and this collapse and fainting spell with Hillary Clinton, does that happen from pneumonia? Can that happen from pneumonia, walking or otherwise? Let's ask Dr. Rashini Raj, internist at NYU Langone Medical Center. Dr. Kennett, in other words, I've had pneumonia, others have had pneumonia. I don't think it's unusual, but the fainting spell, can that happen?
It can, Neil. I mean, we know the common symptoms of pneumonia are things more like a cough or fever, but you can certainly get fatigue. You are more prone to becoming dehydrated, overheated, and you could potentially have a fainting spell or just feel weak in general.
So she's had prior incidents of blood clot in her brain from a little episode where she fell some time back. So people automatically, doctor, seize on a development like this and say, well, there's something they're not letting on. And one of the first things that came to mind was the fact that her staff was attributing this to heat and all of that and never saying anything about the diagnosis of pneumonia prior. What do you look for? What are some of the things you look for to sort of assess someone just visually when you look at them on TV or otherwise?
Well, I mean, looking at her over the last several days, she actually looks quite well other than this incident. So I do think that, you know, this is more what we're talking about, the milder case of pneumonia, what we call a walking pneumonia. Now, certainly on that one day, September 11th, she was stumbling a bit, so she did look fatigued or weaker. But if you look over the last several weeks, she doesn't look like someone who is seriously ill. Even taking into account this cough that she's had, you know, pneumonia can be difficult to diagnose in the beginning. Maybe the cough was this beginning of pneumonia, or maybe it was allergies, and then it progressed to something more that was more recently diagnosed.
We tend to scrutinize older candidates. She'll be 69, I believe, later this month. Maybe next month. I could have it wrong. Donald Trump is 70. Do we pay too much attention to that? Because John Kennedy, memory serves me, in his early 40s, had a host of ailments that we never knew about until well after his death, including Addison's disease.
True. So just because you're older or younger, it doesn't necessarily give you a huge indication of what's going on inside and your overall health. But as we get older, we are more prone to chronic diseases, more serious diseases. So I do think it makes sense to pay more attention to an older candidate. In general, though, you know, our personal medical information, we really pride ourselves on keeping that private in the medical community. In this case, however, we of course want to know as much information as we can to make sure people are able-bodied and able to, you know, fulfill that role as president.
Do you, when you hear candidates speak out, I mean, as a doctor, I mean, do you think that the better part of valor is just to fess up and be honest about it? Would you advise patients, particularly those in the public sphere, that it's better, or as the president said today, let the candidates decide on a case-by-case basis?
I think it's very complicated when it comes to medical information, because sometimes when you release certain things, it can be misconstrued, misinterpreted, and certainly used against you by your opponent.
Right.
So it's very complex. I think maybe if there was some sort of impartial medical board that could evaluate the candidates and give their 2 cents, maybe that would be helpful. But it's a slippery slope. And, you know, you hear the word pneumonia, people think that's very serious and scary. As you said, you've had it. Many people have had it. It can be mild. And maybe they didn't feel it was that relevant or important initially to disclose it.
Doctor, thank you very, very much.
Thank you.
Again, Hillary Clinton is expected to resume her schedule, we're told, the latter part of this week, even though a number of people have said that that might be kind of hard to do as she needs her rest to get ready for the big debates, a couple of weeks off. In the meantime,